Hello, my name is Dr. Larysa Smith, and today I want to answer the questions when and why bone graft is necessary for dental implant placement. Bone graft is necessary when there is not enough natural bone to support implant. It could be a result of long-term tooth loss, periodontal disease, or trauma. All of those situations will lead to shrinking of the initial bone volume. One of the most common areas where bone grafting performed is a posterior upper jaw where sinuses are located. Following tooth extractions, the sinus cavity might have expanded and encroached on the remaining bone. This can result of insufficient bone height for implant placement. In this case, sinus lift is performed, which involved lifting of the sinus membrane and placement of grafting material under it to create enough space for implant. It can be done simultaneously with implant placement, or it could be separate procedure, depending on the initial amount of bone we're dealing with. Another example of the situation requiring grafting procedure, it's a tooth extraction immediately following by implant placement, where large gaps exist between the extraction socket and the implant. Those gaps will be filled with grafting material, which will hold the space until the natural bone will grow into the area. Otherwise, it fills out by soft gum tissue, which grows much faster than a bone, but does not provide support for the implant. Another common situation is just long-term tooth loss. Jawbone is in the extraction site may naturally resorb, and it's not stimulated by pressure normally applied to the tooth. The jawbone becomes narrower and flatter over time, and this can create inadequate ridge shape for implant placement. Bone grafting techniques could be used to build up height or width of the bone, or both if necessary. Bone grafting material can be obtained from the patient's body. It could be processed bone from the tissue bank. It could be synthetic bone graft, or it could be combinations of those. Grafting material used as a scaffold, stimulating new bone and eventually integrating with the patient's bone, or it's replaced by patient's bone completely. The need for the bone grafting determined case-by-case basis. Comprehensive evaluation, including 3D imaging, will allow dentists to assess the bone condition and determine need for grafting. Experienced implant dentist will discuss the treatment plan with the patient, including the need for bone grafting, and guide patients through all the steps to ensure the best possible outcome for implant placement. My name is Dr. Larysa Smith. Have a wonderful day.